Hello and welcome to NCTV episode 59, which is all about knowing the signs that indicate that you may need a total hip replacement. I was going to keep this broader and talk about all aspects of a hip replacement, as this is a conversation that comes up quite often in clinic. However, as there are a number of related subtopics to the matter, such as when you might need one, how to prepare for one, the do's and don'ts following surgery, and the rehab after surgery. So I thought that it was best to tackle these over several episodes, as these are obviously supposed to be bite-sized health tips, so more of the other topics to follow, but today we start with the signs that you might need one. Before we dive in, it should be said that most hip problems can be resolved without a full hip replacement, and there is a range of treatments available such as osteopathy, physiotherapy, medication and hip resurfacing that may better address the symptoms. If your hip pain is not severely limiting your daily life and you found ongoing relief from these less invasive treatments, then it indicates a hip replacement isn't necessarily necessary yet. Now try saying that 5 times in a row and quickly. That said, there are clearly times when people may have exhausted all other options, and as a last resort, the total hip replacement is the only way forwards. While there are no set rules when it comes to hip replacements, surgery is commonly associated with older patients, and essentially it's a life-changing procedure for anyone with a worn hip joint. Here are some signs indicating that you may need a hip replacement. Bear in mind that these could also be symptoms of other problems, and the best way to accurately diagnose the state of your hip is to speak to a specialist and have an X-ray. The first sign is, unsurprisingly, hip pain and groin pain. This is one of the major indicators that there may be an underlying problem with your hip joint. This can manifest itself in a number of ways. For example, when walking, you may find that you're unable to walk your usual distances or even complete your usual daily activities. You may also find yourself compensating with a limp, relying on a walking stick, or even needing painkillers just to cope with the pain of walking or other activities such as climbing of the stairs or getting in and out of the car. Another way the pain may manifest itself is during or after exercise. This may, of course, stop you from being as active as you normally would be, for example, when jogging, swimming, or doing other physical activities. If that's the case, then this may be a sign that you have hip arthritis. And when this occurs, the pain is usually localised between your hip and your knee. If it happens to be lower down towards the ankle, the issue might actually be caused by a back problem. The other common pain pattern is night pain. The pain in the hip at night might make it hard for you to fall asleep, or you may find yourself waking up because of the pain caused by movement. Remember though that there are a number of hip or joint related issues that it could be, so if in doubt, get it checked out. The second sign is stiffness in the hip, and this may be apparent if you have difficulty putting your shoes or socks on, especially if one foot is more difficult than the other. You may also start to feel your hip joint clicking, popping or grinding in ways in which impair your normal range of movement. In some cases, this may ease over time with conservative treatment, although if it's an ongoing problem, you should speak to a physical therapist or a specialist. The third sign is more of a physical test that you can do in the comfort of your own home, and this involves attempting to stand on one leg for longer than a minute. If you can't do that, even with support of say a chair, table or a door frame, then you might have a problem with your hip joint. A few other exercises you could try to see if you are in need of treatment for your hip are when, lying on your back or sitting, can you bend your knee up to your chest? And you can assist with your hands to do so. Again, lying on your back, can you move your leg out to the side without moving your trunk? Finally, sitting on a chair, can you place your ankle on the opposite knee and let the knee drop out to the side as far as possible? Try these on both sides and see if there's a difference. And And finally, the fourth sign that you may need a hip replacement is that if your hip isn't improving following a course of more conservative treatment options mentioned earlier, and the pain is severely limiting your daily life. That's all for part 1 of the topic of hip replacements. Tune in again next week for part 2 and for more bite-sized bits to help your health flourish. Bye for now.